Hi everyone, my name is Dr.Mazhar and today I just would like to start about the respiratory system. The respiratory system, I I will briefly talk about the what not basic anatomy of respiratory system and its physiology. So respiratory system, because in respiratory medicine we discuss about the normal anatomy and normal physiology, then we will start our respiratory medicine pathology. Okay. So before starting respiratory medicine, I just start the anatomy. So in the anatomy include the respiratory system, that there is the upper respiratory system and lower respiratory tract system. Upper respiratory tract system include your nostril, your nasal cavity, and your nasopharynx, your oropharynx, and your laryngopharynx. So this is the nostril. So nostril is the, you can see this is also we call nasal cavity. The nostril is the entry point from where you inhale. When you inhale the air, so air just enter in your nose through nostril. This is the nostril, through your air enter, travel back and come down to the trachea. Okay, so this is about the trachea system. So this is the your upper respiratory tract. So upper respiratory tract include nasal cavity and your nasopharynx and your laryngopharynx. This is the upper respiratory tract. And this is the lower respiratory tract, which include trachea, bronchus, and lungs. So this is the basic anatomy, that how you will define what's the upper respiratory tract and what is the lower respiratory tract. So inside the nostril, there is some cilia air, which moisturize the entry air, because if air enter, if all air go inside in your lung, so it can cause some problems. So nostril cilia function just to make air fresh, and then it can allow the air to enter into the lung. So this is the also normal physiology. Okay, and then I just talk about that this is the anatomy, that there's a right bronchus, left bronchus, and lungs, then your primary bronchus, secondary bronchus, and your bronchioles. After then, there is a terminal bronchioles. In terminal bronchioles, then there is a alveoli. In the alveoli, then there is a capillary. You can see that this is a capillary, this is the alveoli. See how the oxygen and how the carbon dioxide exchange. So oxygen in the alveoli, oxygen pressure high, so it diffuse. It's a diffusion from the alveoli into the capillary. In the capillary, carbon dioxide pressure high. The carbon dioxide from capillary enter into the alveoli. So this is how the gas exchanges take place. So this is the alveolar sac, and in the sac there is the alveoli, and this is the capillary, and this is the pulmonary artery. This is the pulmonary vein. So pulmonary artery contain your deoxygenated blood, and pulmonary vein contain your oxygenated blood. So in the lungs, this is the opposite system. In your whole body, if this is artery, so it is mean oxygenated blood. But for here, it's the deoxygenated blood. Pulmonary artery contain deoxygenated. When it comes, it exchange with the exchange, because when you inhale the air, so you take the oxygen into the capillary. So this is how the gas exchanges take place. So you can see this is the primary bronchus. When primary bronchus, this is the primary right and this is the left. So right bronchus somehow vertical, or and left bronchus somehow horizontal. And this is the secondary bronchus. And this is the diaphragm. So diaphragm help during inspiration and expiration. In a normal person, men have thoraco-abdominal respiration, but female have abdominal thoraco-respiration. So this is how when your diaphragm become flat, because when you are taking inspiration, so during inspiration lungs expand. When lung expand, diaphragm pull down. When pull down, it not become dome shape, it become little bit horizontal shape. But when expiration, so diaphragm comes towards your normal position. So this is how your inspiration and expiration happen, through the contraction and relaxation of your diaphragm. So lungs contain what? vagus nerve, lung contain also what your parasympathetic and sympathetic. So sympathetic what beta 2 receptor which can cause bronchodilation, and the this is the cartilage. This is the ribs. So lungs is also covered by ribs. So this is the space. This is space between two lungs we call mediastinum. So mediastinum is the location from where your heart is located. This is we call mediastinum. And then there is a notch. You can see the notch. This is we call cardiac notch present in the left lung. For what? Just here your heart is sitting. So heart is sitting more on the left side as compared to right side. Why? Because here is a cardiac notch. So this is the sitting position for heart. So this is the thing how your chest. So chest means thoracic. So thoracic will contain your lungs. So right lung have how many lobes? Three lobes. And left lung contain how many lobes? Two. So so your upper lobe, your anterior side of the chest, when you auscultate anterior of the chest, it means you are auscultating upper lobe. But when you are auscultating back side of the chest, it means you are auscultating what? Your lower lobe. Okay, so this is the thing. Now I'm talking about the conductive pathway. This is the conductive pathway, how your entry air goes in, and this is the exchange pathway, that how your oxygen carbon dioxide exchange with each other. So this is the conducting pathway. Then I just talk about what's the division. So in the divisions, there's nose, nasal cavity, and sinus, pharynx, and larynx. This is the upper respiratory tract system. You can see in the picture. Okay. Now I just talk about that this is the how the air entry through nares, air enter, concus, and then into the nasopharynx, oropharynx, and this is the laryngopharynx. Okay. This is the normal anatomy. Why I just talk about this anatomy? Because when we talk about in respiratory system in bronchioles, because some disease like asthma, COPD, emphysema, so these diseases present in your bronchiole because bronchiole contains smooth muscle. So if you don't know about the normal anatomy, normal physiology, you will not know anything about how you understand respiratory medicine. Okay, so terminal bronchiole contains smooth muscles which play a role in the pathology of asthma. Okay, guys. So this is about the basic anatomy. In my next lecture, I will talk about respiratory physiology, brief physiology. Then we will start about respiratory medicine. Okay. For now, take care, guys. Thank you.